So we're on our way to my post-op appointment, and bear with me with the angles and honestly the whole quality of this vlog because, well, I can't really lift my arms very high to hold the camera or anything. Yeah. Day 3 post-op. And gosh, okay, let's just go over some updates. So I leaked pretty hardcore for the first 2 days. Well, mainly for the first day, but I thought I was done leaking, but I just lifted my elbow and I felt something cold and I asked her to look at it, and apparently I'm leaking again. I would show you, but once again, the whole range of motion thing on the arms, not all there. Anyways.
So that's a good thing.
So that's a good thing that I'm leaking because it helps with the healing and the swelling goes down and everything. Basically in the procedure, they pump you full of like saline and lidocaine, and yeah, it's got to come out somehow. So that's how it's coming out. Anyways, how I'm feeling right now, well, I've been in this garment because my surgery was on Friday. It's now Monday that I'm seeing him, and usually I think he sees patients the next day, right?
Yeah, but he said as long as it's within the first week, it's okay.
Yeah, so it's fine, but like Emily got to go in the day after her procedure to have her garment removed and check everything and change dressings and all that. So I've been in the same garment and like wound dressings since Friday, and I'm very itchy in this garment because if you think of it, it's so gross. Okay, TMI alert, but you leak and then it dries, and I took a shower in this thing, and it's just very, and then there's like the tape that holds down all the garments and stuff. It's very like itchy and uncomfortable.
Okay, so at the post-op, getting ready to take off the bandages and compression, change them.
Okay.
It's normal to feel a little lightheaded, a little bit of nausea.
Okay.
So we're going to try to do this slow. I'm going to take off the garment all the way to the bottom and then remove anything that's around there. Once I'm done with that, I'll just have you sit down, okay? And then I'll take everything off. Put this down. As I'm taking it down, you're going to kind of remove your arm, okay?
Took off my garments, and the biggest thing that I noticed is I get it from the front. Like that, but just the like front.
Look at the marks from the bandage.
I know, that's what's been
so
red. But do you see how my arm is? It doesn't like. It used to be so. Sorry. It doesn't look as like big. I feel really good. I've been taking the pain meds, but we're not today so far. Today's a lot better. I'm glad to have the garment off. I was getting really itchy and uncomfortable kind of in that. I feel, I feel pretty good actually. I don't feel too wiped out. I feel like I'm able to kind of get around. I've been taking it easy for sure.
Dizzy or not?
No, not really dizzy.
Just getting up and down pretty well.
Good. Eating and drinking okay?
Yeah.
Good.
Just like normal.
All right. And you leaked quite a bit?
A ton afterwards. I'm still leaking.
Good.
So.
All right, well that's okay. I mean, actually the more you leak the better because all that fluid is going out. Usually people that leak more have less bruising. Usually ones that don't really leak, they don't have more bruising with things.
Right, okay.
And some people have more fibrotic tissue, almost more like scar-like tissue in that layer of fat.
Right.
And usually those people tend to have more inflammation, and then inflammation is causing the pain with their lipedema and causing that fibrotic change in the tissue.
Okay.
And you are one of those people that had a little more of that fibrosis in the tissue. And along with that, your skin has a very pliable quality, not only from the weight loss and the stretch marks and skin getting thinner, but you also have a condition called Ehlers-Danlos with that hyper mobile skin, and the joints tend to be hypermobile, and your skin has that pliable quality to it. And that combination makes it a little bit more challenging in a certain way, and releasing that fibrosis you tend to feel. So that's another reason why you tend to feel more in surgery itself too.
Right.
And then you can understand though why I can't just have you under. The positioning is very important. You want to have you on your side and you're arching yourself. there's a reasoning for that, so you can follow that layer without ever jabbing the muscle, which is causing a lot of bleeding and bruising unnecessarily.
Yeah.
And then poking and jabbing, disrespecting the skin. The way I'm working that skin is really important, and if you're in the wrong orientation and surgeon's just kind of in there, you just can't get as good a result with things. So it's really, really important. So let's take a look, okay? Can we stand over here? Move this out of the way. From a bulk standpoint, it seems a lot better with things. Hopefully as time goes on, this skin will lift up and tighten. And I also think that there are some non-surgical stuff, and I told you this, that we can also consider later on to get a little more lifting, and then ultimately see there's enough tightening there so you don't have to have a break plastic.
Right.
Good. You look clean. You look great. I mean, even the arms really, there's almost no bruising. Just by marks from the surgery.
Awesome.
You know the routine. Is there just what? Any questions for me? You're going to continue with the garments and wear them 24 hours a day for the first 2 weeks.
Okay.
Then 2 weeks after that, 12 hours a day, daytime, nighttime. You can choose. Yeah. Okay. So I'll see you in a few months from now. All right.
Okay. Perfect. Thank you so much, Dr. Angela.
Take care.
So back to the doctor's office, we got creation.
My favorite. Oh my gosh.
Sprinkles, creation, and what's the other one?
Look at ATM juice.
But like, we made the good choice this time, you feel?
Yeah,
like,
even though this is what we really want.
Last time we totally got sprinkles. We tried to come here though, it was just at night, so they were closed. But yeah, we're gonna walk back to the car because
look at this one too, Cupcake ATM. How cute is that? Okay, little crazy psychic place.
Good vibes, yes, vibrations.
I don't think it's good vibes, but I like
all
crystals.
That amethyst I need in my life. That rose quartz bring me some love.